And if you have a total tear of a ligament, surgical treatment is the only answer to ankle ligament. Many of these injuries are missed because many times the athletes themselves go to an X-ray clinic, do an X-ray and say there is no fracture, so I am okay, and go back to play. This is common happening with ankle injuries. Taken very lightly, mostly neglected, and then you will end up with a chronic ankle instability, which is a severe injury and hampers your play. So you have to be very careful with so-called ankle sprains. They are not that easy. The knee injury is a very drastic and very common in footballers. I am sure quite a few of them must have gone through these knee injuries. You can see a ligament here which is torn, a ligament here torn, and the cartilage here torn. So tear of the medial collateral ligament, tear of the anterior cruciate ligament, and tear of the medial meniscus. This is a triad very commonly seen in footballers or hockey players. This is a live example. When a ligament is injured here, see the amount of opening of a joint. See the amount of deformity that you can get on operation table. So this ligament on the inner side is torn, the middle ligament is torn, and you can see the amount of deviation that a joint has. Now these are highly unstable joint. It has to be surgically treated. Yes, the same thing, you can see the ligament which is torn from here, the other ligament torn there. So these are emergency surgeries that we got to do. Now a word about RICE. I am sure all of you have heard this RICE. Rest, ice, compression and elevation. RICE. Remember, this is your basis of treatment of any of the sports injury that you see. Rest, R stands for rest, that means you have to rest the part that is injured. You have to ice the part that is injured, put ice over it. Cold helps in decreasing the swelling, numbing the sensations and making the patient more comfortable. Compression in form of a cotton wool and a crab bandage or elastic bandage again stabilizes and splinting the extremity, that's where the rest comes. And generally keep the leg above the body level to decrease the swelling. So this is a basic thing for any injury, muscle, ligament, fracture also. The ligament injury mostly you have to have surgery for total tears. And the same thing what I mentioned, misdiagnosis or a self-X-ray many times leads to a chronic instability, again needs surgery. A word about most common football injury is the meniscus injury. These are due to rotational strains. Your leg is anchored on the ground and body is turned, and the cushion between the two bones, the meniscus, gets torn. Now these are in isolation, not a very drastic or a major injury, very well treated by arthroscopic surgery, which is a keyhole surgery. And this has become a big boon to sports persons. A very limited exposure, a faster recovery, coming back to sports much better, and commonly done around the knees, shoulder, ankle, in that frequency. Even the hip joints have been attacked now. So this is one of the biggest boon of the science is given to the sports people. Commonly muscle injuries, sprains, pulls, tears, again partial and total. A partial injury heals this way, total injury heals with fibrosis. Now look at this. This heals with fibrous tissue formation. Now fibrous tissue is not as elastic as the muscle tissue. So chances of injury, re-injury are very high. And in case of total tears, it is better to do a surgical repair and come back to primary healing without fibrosis. So one of the causes of muscle injury, again coming back to inadequate warm-up and inadequate training. Third is trauma. Again the rise. But what we have to think in muscle injury is when you come back to sports, the lot of attention has to be given to stretching exercises and warming up. Because of the fibrosis, the muscles become stiff and they can be re-injured again, and flexibility decreases. So increase warming up in case of muscle injuries is a must. Now commonly footballers have this the rectus muscle tear here, or a groin injury, or a quadricep. These are very common injuries in football. Again, due to overuse or overthink. This is a groin injury, a difficult thing to treat. It takes a while to get all right. And this is another dreaded injury, the tear of the tendon, tendo-Achilles. Now we see this often when an athlete has received the dreaded steroid injections in the tendon. There are quite a few instances where good careers have gone down the drain just because somebody has injected steroid in the tendo-Achilles because of tendinitis. So it leads to degeneration of a tendon. You can see that there is a gap here, and practically it's very difficult to come back to active sports after a tendo-Achilles injuries. So as far as possible, stay away from steroid injection anywhere in the body, specifically in the tendo-Achilles. A lot of injuries we have seen, a lot of ruptures we have seen with steroid injections. Now coming to overuse injuries. Now these are generally very subtle injuries, not commonly seen, or by the time they are diagnosed, quite some time goes. They attract less medical attention as they are not instantly disabling. Now mark, this is very important statement. Most of these injuries are taken lightly till they go on increasing, and then it's very difficult to get over it. So to whom you get this overuse injuries? A sudden increase in workout. You got a competition coming, you got a tournament coming, and you have to deadline. These are the people who get it. Overtraining, or take up a new sport activity, or coming back from rest period, faulty technique, faulty equipment, age and physical defect. These are the causes of overuse injury. So in any sport, there is always a tissue build-up and tissue breakdown, what we call a remodeling. Now whenever the breakdown becomes more than the build-up, you will end up with this overuse injury. Or it's a result of repetitive microtrauma to muscle, tendon injuries and doing too much too soon. That's what we call causes the overuse injuries. A common overuse injury is a tennis elbow. And we know the master blaster has been suffering from tennis elbow for the last so many years. Even a surgery hasn't helped him. So it's very difficult to manage these injuries like tennis elbow or a golfer's elbow. You need to have adequate history why the injury has come. You have to go through details of the planning. For example, just holding a racket. If the grip is too big, you can land with tennis elbow. Now common injuries that we see are tennis elbow, golfer's elbow in golf, the medial epicondyle. Cyclists have the ulnar neuritis, very common at the wrist because of the position of the wrist on the handlebars. Shoulder injuries in javelin or the tennis players or the baseball pitchers, very well documented, very well supplemented. And the extreme thing I would say of the overuse injury are the stress fractures. Now these are the fractures which come with over exertion, doing a new activity or overdoing things when you want to really come back to fast or something. Now presents with a pain, a vague pain, not a severe pain, gradually increasing. With rest the pain goes down, the swelling goes down, resume the activity, again it comes up. And the worst thing is initial x-rays, you cannot diagnose this. So again you become complacent, x-ray is normal, so you continue the activity and this thing increases. The only way you can diagnose early is by MRI or radioactive bone scan. This is the only way you can diagnose a stress fracture. So common sites we see is upper tibia, middle and lower tibia, fibula and the foot bones. These are the weight bearing bones which are commonly having stress fractures. But in other sites also like upper femur and this we have been seeing that, not common. So stress fractures are again difficult things to manage. So managing these injuries, overuse injuries, is the first thing is decrease the intensity of training. See where it's gone wrong. See where you have overdone. That this is very carefully done with coach and the athlete. You have to have a good history of this. Start easing out the workout schedule and changing over to cross training. That is, change the sports for a while. Try to go non-weight bearing. Instead of jogging, running, if it's giving injury, change to cycling, change to swimming for some time. Get the muscles going. Then try to analyze if there is anything wrong in the techniques. Is there your throw is not proper? Is your grip not proper? Are you not holding the racket properly? So these are the things to be analyzed when you get repeated injuries or overuse injuries. See that you have proper warm-up or cooling down. And some amount of anti-inflammatory medicines, icing, they help. And this is a very patience on the part of coach, athlete and the doctor when you treat overuse injuries, because they don't go away easily. So you need a detailed, elaborate plan, review training, this is what I said, and physical therapy helps. But basic crux of the situation is prevent the injuries. Now primary prevention is when you prevent the first injury. Now this is where all the things I'm coming back to that. Proper warm-up, proper technique, proper equipment, proper weather condition, proper ground condition, they all come to play in preventing the first injury. And if you prevent the first injury, the subsequent injuries are automatically prevented, because then you are mature enough, the athlete is mature enough to take care. Secondary is more difficult because generally you again get those injuries and you really require a slow thing. So proper fitness, it's been well documented that athletes who were fit, they get less injuries, unfit athletes get more injuries. Very slow comeback to active soccer after injury. Start with aerobic training, conditioning, strengthening and agility training before you go back to soccer. Try to get well prepared before you start the game again. Avoid pressures of overtraining. You can sometimes they advise you even to stop, don't play for this season, aim for the next season. That is what we should do whenever the overuse injuries are. Another good thing that is being done now is most of the clubs and the teams have their own physios, their own doctors and their own analysis of the hospital tie-ups. Now that helps before competition or before beginning of the season. A routine medical examination of all the athletes. You can definitely identify some old hidden disease, or you can identify old injuries and take precautions, take prevention for further injuries. Thank you.